What if that nasty sunburn on your horse wasn't actually, just a sunburn? What if it was a flashing red light for something much deeper, maybe even life-threatening? Today, we're taking a deep dive into equine photosensitization. It's a condition that's, well, far more complex than just too much sun and often misunderstood. We've pulled together your provided sources, the latest expert articles, research, and our mission is really to cut through the noise.
Yeah.
We want to extract the most important nuggets of knowledge so you can truly wrap your head around what's happening beneath the surface.
Indeed. It's a really fascinating condition, partly because it's so deceptive. The superficial signs, those severe skin lesions, they often completely mask an entirely different underlying problem. And unpacking that distinction as well, it's crucial for both diagnosis and finding the right treatment.
Right.
So we'll explore the different types, how you can spot the crucial signs, and most importantly, what steps you need to take.
Okay, so let's really get into this then. The research makes it abundantly clear. Photosensitization is not just a bad sunburn, even though, yeah, the skin damage can look incredibly similar sometimes. So at its core, what are we actually talking about here?
Okay. At its core, photosensitization is a severe skin reaction. The horse's skin becomes abnormally sensitive to ultraviolet light, UV light. This happens because specific light-reactive compounds, we call them photodynamic agents, get into the horse's system somehow.
Okay.
When these agents absorb that UV light, they trigger a damaging chemical reaction right there within the skin cells. And this leads to inflammation, cell damage, and in really severe cases, tissue death necrosis. It primarily impacts the unpigmented, the white areas of the skin.
So it's chemical reaction triggered by light, but specifically targeting those white patches of skin.
What makes that distinction that it's not sunburn so critical for horse owners, beyond just the technical definition? It's critical because, well, a typical sunburn is direct UV damage to the skin cells. Photosensitization, though, it acts more like a hidden trigger. There's a chemical agent already inside the horse's body just waiting.
Oh. Yeah.
So this means you can't just, slap on some sunscreen and call it a day. You have to find and ideally eliminate that hidden sensitizing agent.
Right. You need to get to the source.
Exactly. It fundamentally changes how you approach prevention and treatment. That lack of skin pigment, the melanin, and maybe thinner hair cover just allows more UV light to get through to where those agents are sitting. That's why white areas are so vulnerable.
Okay, so we know it's about these agents, but the sources reveal it gets pretty complex here because how these agents actually end up in the horse's system varies quite a bit, leading to different types of photosensitization.
That's right. The two main categories, the ones we see most often and are most important to understand, are primary photosensitization and hepatogenous photosensitization.
Hepatogenous.
Being
Liver-related.
Exactly. Hepatogenous is often called secondary photosensitization.
Okay, let's start with the primary type first, sometimes called type I. How do these photodynamic agents get into the horse in this case?
So in primary photosensitization, it's pretty direct. The horse ingests, or maybe inhales, or even absorbs through the skin a photodynamic agent. Once that agent gets into the circulation and reaches the skin, it reacts directly with UV light. Critically, these agents don't need any liver problem to become active. The liver's functioning normally.
Okay, direct action. So what are some of the common culprits here? Things that cause this direct reaction? What should a horse owner, be looking out for in the pasture or feed?
Yeah, a lot of them are plants. For example, St. John's wort is a classic one. It contains a compound called hypericin. Think of it like the plant's natural sun sensitizer. Buckwheat is another, bishop's weed, spring parsley. They contain chemicals called furocoumarins, which are also light reactive.
Okay.
Certain clovers, too, Alsec clover especially, are strongly implicated. And even some weeds like giant hogweed, if the horse just brushes against it, can cause a contact photosensitization.
Wow, so just touching it.
Yes. Potentially, but it's not just plants. Certain common drugs like some antibiotics, tetracyclines, or sulfonamides can do it, and even things like coal tar derivatives, which you might find in some, older topical skin products.
Interesting. Okay, so that's the direct route. But you mentioned the other type, hepatogenous or type 3, is actually the most common in horses. And this one points to a much bigger internal issue, right? What's the major difference here?
The key difference, the absolute key, is impaired liver function.
Okay.
Think of your horse's liver like a really efficient processing plant for the body. Normally, when a horse eats green plants, the chlorophyll gets broken down in the gut into a compound called phyloerythrin.
Phyloerythrin, okay.
Usually, a healthy liver quickly grabs this phyloerythrin, processes it, and excretes it safely, usually in bile, makes it harmless. But if that liver is damaged or diseased, that processing plant, well, it breaks down. It can't handle the photoerythrin properly.
So it backs up.
Exactly. It backs up, accumulates in the bloodstream, and then gets deposited in the skin tissues. And then when that skin gets exposed to UV light, that accumulated phyloerythrin is what causes the damaging reaction.
So this type is really a symptom, a red flag, signaling that the liver isn't coping.
Hmm.
What kinds of things actually cause this level of liver damage that leads to photosensitization?
Well, again, clans are often a major culprit, especially those containing pyrrolizidine alkaloids.
All right, those sound nasty.
They are. They're toxic compounds found in plants like ragwort, rattlebox, houndsdung. There are quite a few. And the really worrying thing is the liver damage from these is often cumulative. It builds up over time.
Oh, so it might not be obvious right away.
Precisely. And sadly, it can often be irreversible once it reaches a certain point. Interestingly, Alsite clover pops up again here. It's a bit tricky because it can cause both primary photosensitization directly and it can cause liver damage leading to the secondary hepatogenous form.
Huh. Double trouble with that one.
Yeah. Other causes can include moldy hay or feed containing mycotoxins, fungal toxins that damage the liver, even certain types of blue-green algae if horses drink contaminated water. And then beyond toxins, other liver diseases themselves, things like Thaler's disease, which is a form of acute hepatitis, or chronic active hepatitis, can also impair the liver enough to cause this phyloerythrin buildup.
We saw brief mentions in the sources of a very rare type 2 and an idiopathic type 4, meaning the cause is unknown. But let's pivot to something really practical for prevention. Risk factors. What does all this mean for which horses are actually at higher risk?
Right. Well, regardless of the specific type, type R, type 3, certain factors definitely make a horse more vulnerable. Firstly, and this is absolutely key, unpigmented skin. Photosensitization almost exclusively affects areas of white skin or skin with very sparse hair cover.
Like the muzzle.
Exactly. The muzzle, eyelids, ears, the pasterns around the coronary bands, and any white markings or patches on the body. This is simply because melanin, the pigment in dark skin, acts like a natural UV filter. It protects those areas. White skin just doesn't have that protection.
That makes perfect sense. So breeds that tend to have a lot of white are just naturally more susceptible, like paints or Appaloosas.
Exactly right. Breeds like paint horses, Appaloosas, even Belgians with those big white socks and blazes, they're inherently at higher risk simply because they have more vulnerable skin surface area exposed to UV light. And of course, you need the trigger. Direct exposure to sunlight is necessary for the chemical reaction to actually happen in the skin.
Okay, so let's say you suspect your horse might be affected. What are the actual symptoms you should be looking for? The sources indicate the clinical signs look quite similar regardless of the underlying cause, mostly involving that severe skin inflammation.
That's generally true, especially the skin signs themselves. They typically appear, maybe a few hours after intense sun exposure.
And what are those crucial early signs, the things that should really grab your attention right away?
Okay, in the acute phase, the early stage, you'll first notice intense redness, we call it erythema, and significant swelling, edema, in those affected white skin areas. The skin will also be noticeably warm, maybe even hot to the touch. This swelling can be quite dramatic. Sometimes the eyes appear swollen shut or the lower limbs stock up. They look thick and puffy.
Wow.
Horses will usually be visibly agitated, quite restless, definitely uncomfortable. You might see them rubbing or scratching the affected areas or desperately trying to get into the shade.
Poor things.
Yeah. You'll often see clear, fluid serum just oozing from the skin. And intense itching, pruritus, is common, particularly with that primary type we discussed. They might also show photophobia, that's a painful sensitivity to light, so they might be squinting or trying to avoid bright light.
And if it's not caught early or in really severe cases, what happens then? How does it progress?
Well, in more chronic or severe situations, as that oozing fluid dries, thick crusts and scabs will form. They can be yellowish or even black. The skin itself can actually start to die off. That's necrosis. It becomes leathery, dry, and dark.
Oh, that sounds awful.
It is. And large pieces of this dead skin can then start to peel away or slough off. This exposes raw, intensely painful, often ulcerated tissue underneath. And of course, there's significant hair loss in those areas.
And those raw areas must be prone to infection.
Highly susceptible. Secondary bacterial infections are a major concern. You might see pus-like discharge, a foul odor. And something really gruesome to watch out for is fly strike maggots infesting the damaged tissue.
Oh, gosh.
And if the coronary bands or the lower limbs are severely affected, it can lead to profound lameness Or in the absolute worst case scenario, the entire hoof capsule can actually slough off.
That's devastating. Now, this raises a really important question we touched on. If the liver is involved in that hepatogenous type, are there other signs beyond just the skin that we should be watching for? Signs of the underlying liver problem?
Absolutely, and these are critical clues for diagnosis. Jaundice, or the technical term is icterus, is a key indicator of liver dysfunction.
Okay, jaundice, what does that look like?
You'll see a distinct yellow discoloration of the mucous membranes, check the gums, inside the eyelids. Also, the whites of the eyes, the sclera, will look yellow. Sometimes even unpigmented skin can take on a yellowish tinge. It's all due to the buildup of bilirubin, a waste product the liver normally handles.
Got it. Yellowing. Are there other signs?
Yes, other systemic signs can include lethargy, just general depression, a loss of appetite, maybe weight loss over time. Some horses might show signs of mild to moderate colic. And in the most severe cases of liver failure, you can see something called hepatic encephalopathy.
Brain-related.
Yes, that's when liver toxins build up and affect the brain. It presents as neurological signs. The horse might seem disoriented, wander aimlessly, press its head against walls or fences, or even appear blind.
Wow, so the signs can range from skin issues to serious neurological problems if the liver's involved.
Exactly. It really highlights how serious the underlying issue can be with the hepatogenous type.
So if you suspect photosensitization, how do veterinarians actually go about diagnosing it? And crucially, how do they figure out the type, primary or liver-related, and then pinpoint the exact cause?
Well, the diagnosis starts with recognizing those characteristic skin lesions on the unpigmented areas. But then the real detective work begins, identifying the type and then finding that specific causative agent. A thorough physical exam is absolutely critical, particularly looking for that jaundice we just talked about. If jaundice is present, it immediately points towards potential liver involvement, the hepatogenous type.
And what about distinguishing it from just a really bad sunburn? How do vets definitively rule that out? People might just think, oh, he got too much sun.
That's a great point. A typical sunburn is generally less severe. It might be restricted to just the pink skin on the muzzle or around the eyes. And crucially, it doesn't involve those underlying photodynamic agents. Photosensitization lesions are usually much more pronounced. They're often oozing or weeping, as we described, and they can involve that tissue death, the necrosis. The distribution might also be wider, affecting all white markings. The internal chemical trigger is the fundamental difference.
Okay, so physical exam, looking for jaundice, assessing the lesion severity. What specific tests do vets use to dig deeper and confirm things?
Blood work is absolutely essential for any suspected case. Running a blood chemistry panel is key.
What are they looking for there?
They're looking for elevated liver enzymes, things like GGT, AST, ALP, and high bilirubin levels, especially a type called conjugated bilirubin. If those are up, it strongly confirms liver damage and points squarely at hepatogenous photosensitization. They'll also usually run a complete blood count, a CBC, to look for signs of inflammation or secondary infection. Beyond blood tests, a really careful examination of the horse's environment is crucial. Inspecting pastures, checking the hay, any supplements or feedstuffs for known photosensitizing plants or liver-toxic plants.
Like the ragwort or Alsike clover we mentioned.
Exactly. This often requires bringing in someone who can do expert plant identification because some of these plants can be tricky to spot.
Makes sense.
In some cases, a skin biopsy can be helpful. It can confirm the diagnosis of photodermatitis inflammation caused by light. And in really complex or severe cases, especially if liver disease is suspected, toxicology screening on blood or feed might be done. Or even a liver biopsy, although that's more invasive, it can provide a definitive diagnosis of the type and severity of liver damage, which is vital for prognosis.
Okay, quite a thorough diagnostic process. So, given how severe this can be, what's the immediate game plan? What's the long-term approach to treating a horse with photosensitization?
Right. Treatment needs to be multi-pronged, and it requires immediate, decisive action. The single most important first step, emphasized in all the sources, is get the horse out of the sunlight immediately.
Number one priority.
Absolutely. Move them into a dark, cool, well-ventilated stall. If turnout is absolutely necessary for welfare, it should only be overnight, from dusk till dawn. And for any unavoidable outdoor exposure, say for vet checks, you need protection. UV-blocking fly masks, especially those that cover the face and muzzle, full-body fly sheets, or applying physical sunblock creams, the thick white ones containing zinc oxide or titanium dioxide, on all unpigmented areas are vital.
Okay, so immediate shade and UV protection. What about tackling the root cause, that hidden agent?
That's the next crucial step. You must remove the causative agent. If you suspect a plant, that means immediate dietary changes. Remove the horse from the suspect pasture entirely. Replace all hay, feed, and any supplements they were getting.
Start fresh.
Completely fresh. If a drug or a topical chemical is suspected, obviously, those must be discontinued right away. You have to eliminate the source of the photodynamic agent.
And how do we manage the painful skin lesions themselves while they heal?
Gentle supportive skincare is key. You want to carefully cleanse the affected areas. Maybe use mild antiseptic shampoos like chlorhexidine or just warm saline soaks. The goal is to gently remove the oozing serum and any loose crusts, but avoid harsh scrubbing, which causes more pain and damage.
Yeah, gentle cleaning.
Right. Then applying emollients can help. Things like petroleum jelly or those zinc oxide creams we mentioned for sunblock also soothe and protect. Specialized veterinary dermatological creams can soften the crusts and prevent the skin from cracking painfully as it dries. For secondary bacterial infections, which are common, topical antibiotics are often needed. Silver sulfatazine cream is a common choice.
Okay.
And sometimes using barrier creams or even breathable bandages can help protect those raw, ulcerated areas from flies, dirt, and further irritation.
And what about the horse's comfort? Dealing with the pain and inflammation.
Very important, systemic anti-inflammatory drugs, NSAIDs, are usually given. Flunixin meglumine-banamine is a common brand, or phenylbutazone, bute, are used to reduce pain and inflammation. In really severe acute flare-ups, veterinarians might consider using corticosteroids for their potent anti-inflammatory effect, but they use them cautiously, especially if liver disease is suspected, as steroids can sometimes stress the liver.
Right, that makes sense.
And connecting back to the bigger picture for those hepatogenous cases, supportive care for the liver itself is just as important as the skin care.
What does that involve?
It can include things like intravenous fluid therapy to help flush the system and support circulation. Providing a really palatable, high-quality, easy-to-digest diet is important. Sometimes, if the liver disease is severe, a lower protein diet might be recommended to reduce the liver's workload. Specific liver support supplements might also be prescribed. And preventing those secondary complications we talked about, like cellulitis spreading under the skin or maggot infestation through really aggressive fly control, is also critical.
Makes sense.
Oh, and the research also mentions that in cases where there's a lot of dead skin, that necrotic tissue, surgical debridement, carefully removing the dead tissue might be necessary to allow healthy tissue to heal underneath.
Okay, so it's a really comprehensive approach. Remove from sun, remove the cause, treat the skin, manage pain, support the liver if needed, and prevent complications.
Exactly. It requires diligence on multiple fronts.
So after all of that treatment and management, what's the general outlook? What's the prognosis for a horse that's been affected by photosensitization? Does it vary?
It varies hugely, primarily depending on the underlying type of photosensitization. For primary photosensitization, where the liver isn't involved, the prognosis is generally good to excellent.
Oh, that's good news.
Yeah, if the horse is promptly removed from whatever caused it, the plant or drug, and strictly protected from sunlight. The skin has remarkable healing capacity, even after looking quite horrific initially. It usually heals very well, though sometimes scarring or changes in hair color can remain.
Okay, but for the liver-related type, the hepatogenous type, I imagine it's a different story.
Precisely. For hepatogenous secondary photosensitization, the prognosis is much more guarded, often ranging from guarded to poor.
Why is that?
Because the photosensitization itself is just a symptom of significant underlying liver disease. The horse's ultimate outcome truly depends on the nature of that liver damage. How severe is it, and is it potentially reversible? As we mentioned, damage from things like pyrrolizidine alkaloids is often irreversible. So horses presenting with severe liver damage, obvious jaundice, or especially those showing the neurological signs of hepatic encephalopathy, they generally have a poorer prognosis. The liver may be too far gone.
That makes sense. The skin is just the tip of the iceberg in those cases.
Exactly. And other complications also worsen the outlook significantly, things like severe widespread skin necrosis, deep secondary bacterial infections that become systemic, or the development of laminitis secondary to the systemic stress and inflammation.
So it really boils down to catching it early and acting fast, doesn't it? Especially figuring out if the liver's involved.
Absolutely. Early recognition of those initial suspicious skin lesions, immediate removal from sunlight that's non-negotiable, and then working quickly with your vet to identify and eliminate the causative agent are the absolute most critical steps for achieving a favorable outcome, regardless of the type, but especially crucial if there's underlying liver disease.
What an incredible deep dive. We've really peeled back the layers on equine photosensitization today. It's amazing how something that looks, at first glance, like a simple sunburn can actually be this complex reaction to environmental toxins, or even more seriously, a critical warning sign of significant liver disease.
It really does highlight the intricate connections within the horse's body, doesn't it? And how external factors, sometimes really subtle ones like a common plant in the pasture, can trigger such profound, systemic, and potentially dangerous effects on their health.
It certainly does. Thinking back on our discussion, what really stands out to you? Perhaps something that maybe shifted your perspective or that you find particularly important for owners to remember.
Yeah.
Maybe it's that surprising range of common plants that can be photodynamic agents, or the absolutely crucial, often hidden role of the liver,
Mm.
or just reinforcing that dramatic difference between a bad sunburn and this potentially serious condition.
For me, I think it really brings up an important question, maybe more of a reflection for all of us involved in horse care. It's about how do we become even more attuned, more vigilant to the subtle changes in a horse's environment? Everything from the specific plants in their pasture, maybe weeds creeping in, to the hay they eat, even the medications or supplements they receive. How do these seemingly small details potentially have such profound systemic effects on their health? It really underscores how every detail of their care is just so interconnected and important.
That's a fantastic thought to leave our listeners with. How can we sharpen our observation skills for those subtle environmental clues? A great thing to ponder as you continue your own deep dives into the world around you and the animals in your care.